Coming to you live from South Africa.
Welcome back to the Nafeesa Dangor Show, where, of course, we're trying to entice you into a better space this afternoon, this very 2021. And there's lots of people actually reaching out there to try and make differences in many ways to others and try to better their lives. And we thought we'd like to encourage you to listen to this next one, because I think you really need to go and grab that cup of coffee and join us, because there's something really interesting coming up. And I don't know if you've ever heard of the word Clownselor. Now, a team of Clownselors whose aim is to spread smiles in children's hospitals. They're the types of people that are a volunteer-based group engaged in medical clowning. What it means is they dress up as clowns, they interact and perform different acts for children and adults. They, of course, use humor to expedite the healing process at hospitals, along with sessions at old age homes, to reach the remotest parts of the country and to help ensure better healthcare facilities for all. They say doses of laughter is given the same importance as medication. Now, clowning is introduced in all care centers, schools, and workplaces, and this is coming out of India. Now, the gentleman, let me tell you, the person that I'm going to be speaking to this afternoon, he's 30 years of age, and he joined Clownselors in 2017. His name is Tushar Agarwal. He was relocated to Delhi from Ahmedabad, had volunteered for clowning in Ahmedabad prior to that. Before the lockdown, he was volunteering on a weekly basis at Chacha Nehru Bell Chikitsalayah in Delhi every Saturday whenever he was not traveling for work. He is an environmental consultant who works on issues related to water, stress, and climate change for clients located in India and elsewhere. And his work organization is Environmental Resources Management, and he was based in Delhi NCR prior to the lockdown. A very good afternoon to you, coming all the way out of India. Thank you so much for joining me on the Nafeesa Dangor Show this afternoon, Tushar. It's nice to see those little goodies there happening at the top. I see you enticing me into a better space this afternoon. Just looking at that is making me smile already. And oh, wow, okay, there we go. Sheetal's on the line as well. And I think that's a grand surprise. And let me tell you a little bit about Sheetal before we even go into it. Thank you so much for joining us on the Nafeesa Dangor Show. You've already uplifted my spirits just looking at you this afternoon. Sheetal is a sociologist, a social anthropologist by training, a lecturer by profession, and a big clown at heart, as you can see. She's the founder of Clownselors. She started medical clowning in Delhi in July 2016 and has received enormous support and appreciation from hospital authorities, the health ministry, as well as people around. She has received many awards for work. So very welcome to you, Sheetal, this afternoon. Thank you so much for making the time to join us here on the Nafeesa Dangor Show all the way down in South Africa.
Thank you.
Talk to us about Clownselors. You know, I think when my producer spoke to me about this, I was a bit taken aback here. I was like, what are you talking about? I mean, I know a counselor. Did you say the wrong name by mistake? And she said to me, no, we're going to be talking to Clownselors. And Tushar is laughing because I think a lot of people will agree with that. And I said to myself, but wait a minute, I need to do a little bit of research on this. And just reading a little bit about you got me going in a different direction. So talk to us, Sheetal. Let's start with you about Clownselors, how it started off, and of course the aim of it. And I mean, I see Delhi is very lucky to have people like you around.
Clownselors actually started by accident. I mean, I didn't know of medical clowning. Yeah, because I didn't know of medical clowning. I was fascinated by clowns when I was growing up. And at a retreat in Ahmedabad, somebody introduced herself as a medical clown. And I thought to myself, what is a medical clown? And then when I read about it, when I watched the movie Patch Adams is the man who started medical clowning. I was intrigued and I wanted to try it, just have an experience of how is it done and giving purpose to a smile. And that's how Clownselors was born. We started with 5 volunteers. The aim is to cater to the well-being of patients and their guardians and also the hospital staff. Mainly, medical clowning is a therapy wherein we visit patients dressed up as clowns and make them happy. The idea is to cater to their mental health so that they start feeling better mentally, because physical and mental health go together. But when we talk about healthcare, we only focus on physical health. So this is what Clownselors does. Uh, the concept is that no hospital bed should deny a person his right to be happy.
I agree with you. And I mean, they say laughter is very good therapy. And, as I said to you, I was in a happy space, but I think I'm in a happier one after just like looking at you this afternoon. And just somehow the look and the type of, should we say, a change in a person's emotional well being. I agree with you because having a look at you guys, I mean, it's making me very happy. Tushar, let's talk to you this afternoon. Talk to me about the antelope there. There's something going on there. I'd like to know. It's nice to see this happening because this is something it is so unique. But although it's unique, it's unique in the sense that it brings out the better in a person, and nothing better than a smile, as you said. So talk to us about your involvement in this, and how did you start off with this, as I explained earlier?
Yeah. Thanks, Nafeesa, for having us in the show. Uh, I think my journey of Clownselors started a little bit before when I joined Clownselors, because I was in Ahmedabad and I was working in the same organization, and I was somehow missing some kind of some joy of connecting with the society. And then I was there in I was visiting Gandhi Ashram in Ahmedabad, and I met a person who told me that they are doing clowning in Ahmedabad. And then I visited there, after a lot of dilly dallying, because I thought, how is it possible to make people laugh? It's easier to make people cry.
Exactly.
So, so then I started doing in
Especially in
Ahmedabad.
the hospital, hey? Because you walk into a hospital and somehow the other, the environment is so somber. So I think you bring a different edge and a different spice to the whole environment there.
Yeah. And I think the fun part is that after doing my first few clowning sessions, I realized that I'm actually a madman and I need to just shake it off. So,
should I be afraid? I should know that.
only in a fun way.
Dangerous. I mean, unless it's the antennas on the top, I don't know. But he seems to be quite a timid kind of guy there. But it's nice to see. I mean, already with me, you've changed my emotional well-being in such a way this afternoon, just within this few minutes. So, tell us the purpose about this. I mean, I've already recognized it from this just few seconds that we're chatting. But what was the purpose of this? Besides, of course, just going out and trying to make people happy, there must be some deeper meaning to it. Sheetal, you can answer on that.
Of course, since medical clowning is a therapy which has been around since 1970s, so the deeper purpose is to actually make patients feel better, because hospital spaces are very scary, and they induce a lot of anxiety and stress. And even for guardians, it's very difficult. So the purpose is to actually cater to mental health, like I said before as well, because nobody is really taking care of the mental health. There is a lot of pressure. Then people are, especially when we talk about children, they're very scared of all the injections and drips. So when clowns visit them, they also distract them from the regular procedures, and we help doctors and nurses to smoothen the process for the kids as well as them.
I think it also takes away that anxiety level because, like you were
Yes.
saying earlier, a lot of the patients have a lot of anxiety because they don't know what to expect with their health situation. Kids are very fearful because they don't know why they're in the hospital and what is happening to them. So it kind of enlightens that situation, like you were saying. Tushar, what does it mean for you being a part of this? I mean, I think it's something that has a lot of meaning. People, I think, take it very literally. But there's a lot more to it than just that.
Yeah, I think Nafeesa, the one of our basically observations has been that you know most of the patients come from underprivileged background, and these are the people probably who don't get treated well wherever they go, who always have the sense of anxiety of being in a situation where things are not easy. It's very tough to get the basic needs met. So I guess the bigger purpose is that when we are there with them, and most of us come from a very privileged background, that I'm not proud of, but I accept that that is where I come from. So I think what happens is it is also kind of a situation where in that short time when we are with them, we are able to communicate it in a fun way to them that we are with you, we are with your family, and because most of the patients are kids, we are with your children. And what happens is, there's a certain level of anticipation that goes in the entire hospital, and those
Mm,
kids expect us every week that we will come
mm.
on Saturday. And Sheetal is called Dr. Clown. So every time, the nurses would see her, or the kids would see her. They would either try to hug her, or try to play with her. So it is that is the bigger purpose. I think we are able to exchange something which otherwise our class status does not allow us to exchange.
Hmm. What sort of difficulties have you had now with COVID-19? Are you allowed to still go into the space and interact? It's been very difficult. As I know, there's that social distancing. Hospitals are not allowing extras in. What sort of
Yes.
constraints have you found there, Sheetal?
So we have actually been banned from visiting hospitals. We have not been, since COVID is scary, of course, we are also not pressurizing to go to the hospitals, but we have made videos and sent it to COVID patients whenever we could, or when we came across something like this. And we have moved clowning online. So we have done clowning for schools, and also we were running a mental health series wherein we were talking about why it is important to talk about mental health and to recognize mental health as something as 50% of health. And how, and especially during the COVID times, we all realized that mental health was badly affected. So
Yeah,
another
I do
pandemic.
agree with you. I think it was I
Yes,
think it still is. It hasn't ended.
yes,
I think
of
mental
course.
health is one of the biggest issues at this moment. And I think by you coming in and trying to help out, and that is phenomenal because there's so many people, and as Tushar was saying, I mean, some of them come from underprivileged backgrounds, so they have their challenges already. But what COVID-19 has done is it's just packed it on even more. So it would be so nice. Maybe I have a suggestion for you is to maybe create a nice little something on a video. And I'm sure those hospitals have TVs so that they can put you on those TVs out there and people can still get their smiles for the day.
We tried doing that, but hospitals are already overworked and staff is overworked basically. So they said that it's not possible. I tried reaching out and talked about this, but it didn't work out. But when the lockdown started, so in India, lockdown was suddenly announced, and there were a lot of migrant laborers who were stuck in different cities. So in Delhi, we did manage to go to some of these spaces and clown for them so that they feel better. But I think after visiting two spaces, and then when I was going to another space, I realized that right now what can bring a smile to them is going back to their space, to their families, to their hometowns. And somewhere I felt that maybe clowning is like making mockery of them. So then I refrained from it. But yes, we did receive responses like, this is the first time in so many days that somebody has come to meet us and somebody is trying to make us happy, which did touch my heart. But then it was very difficult, like the kind of sad eyes that I saw on that day, I had not seen that before. So that is when actually it hit me that how privileged we are, and I was feeling very guilty for the privileges that we have been born into.
No, I get what you're saying. And I think it's firstly, we need to be grateful to the Almighty that at least I think we have these purposes. I say each one of us has a purpose in life. And maybe, God has put you in that space there because you have that purpose to be able to help people. And as we spoke about, the most important thing is the mental health issue. Tushar, I think you'd agree with me that would be your purpose too, where you were brought in and what you're doing. I think people take it lightly because it's something fun that you're doing, but there's a lot of actually deep meaning and seriousness to it. As you were saying, I mean, helping the underprivileged and making them feel as they have some form of value actually makes such a difference. And I think it gives you that fulfillment also, knowing that you've made a difference in somebody's life for the day.
Indeed, Nafeesa, because I think we can only get a certain level of satisfaction by by our daily routines, which involves tending to our family and earning to be self sufficient. But then there is always that call, that are we actually doing something better for the society? Because at a certain level we realize that there is a there are more people in this world than just our own family. So this is where I believe that clowning adds that purpose, that we are interacting with a certain section of the society which is not feeling at its best, which is not getting the best services. And
Mm,
whatever we call it, whether it is a higher power or whether it is the human thought process, that we want to do something better. And
mm.
making someone smile is probably the hardest thing to do. It's easier to make people cry. If three of us want to make each other cry, we can do it just now. But how about making each other laugh?
I think you've done a lot of that for me this hour. I absolutely love your concept. I mean, it's something that I think people should look at. And as you were saying, Sheetal, it is a very difficult period. But I think what's phenomenal about the Clownselors is that you've created the support structure for people where I think you increase their hope and their faith, and that they know that they're not alone. There's somebody out there that cares that much. And I think that
Yes.
little goes a long way.
Yes, definitely. So, well, on this, I would like to share an experience. We were visiting this hospital. So, just before COVID, we had started catering to adults as well. So, at one of the hospitals, there was this young boy, young man, who was all by himself and who was in the hospital for some weeks now. And he did not have anybody visiting him. There were other guardians who were taking care of him, who were talking to him. So the nurse came and said that he has nobody. So we said, we are there for you. And we danced with him. And that was the first time people saw him smiling. So after almost 3 4 weeks that he was there, he felt that, yes, there is actually someone who has come to meet him and who cares whether he smiles or not. So we've had those experiences as well.
What experience stood out for you, Tushar, from so many years of doing this?
I, Nafisa, I think for me, emotional situations are a little hard to face. So I generally try to maintain that, smiling persona. And there have been, extremely overwhelming situations at times. I think Sheetal has faced more because she also gets affected a lot. But what have been really, moments of joy and kind of moments of treasury for us were, there have been times when the kids were just not reacting, or they haven't laughed for weeks. And
Mm,
then they would start reacting or laughing, and their mothers would start showering us with love, and they would start giving us some bank notes, just as a token of gift to us. So those moments have been quite overwhelming. And I've tried to I tried to be as as calm or funny in those situations. But those situations have been tough, because there have been people who are overwhelmed by the by the situation in which their kids are. And then when
mm.
they see them laughing, and then they take a 10 rupee note out of their pocket, or a 50 rupee note out of their pocket, I think that makes our day. Even if I don't need the note, I think that whole gesture of seeing the note is itself enough for us, or for
Yeah,
me.
and I think it's their way of showing you the appreciation that they feel for what you've done for them. Um, Shital, what do you see yourself heading in the future? I mean, it's so nice seeing you doing this, but unfortunately, as we're saying, oh, there's a message. It says from Harry Fontu. She says, "Great clowns, hats off to you guys." So there we go. People are listening and they're watching and they're enjoying as much as I am. So that's great to know. Thank you, Harry, for that lovely message. It goes to show, Shital, that you're doing something right. And unfortunately, like I say, COVID has given us these constraints, of movement and having to be able to reach out to people. And as you said, you're starting to work online. But what do you anticipate for yourself and Clownselors in the future?
So, Nafisa, our vision actually has always been going to the villages and talking about how happiness or laughter, why is it called the best medicine, and why is it important to be happy, and how does it affect health. So we've already started working on that line. I have been in Himachal for last 3 months now, and we've gone to villages. On Christmas, we went to villages in Punjab, and we traveled across almost 10, 11 villages and did clowning there. So we are trying to now go to remote parts of the country. Also, online, we are trying a lot of things like, of course, when we say that there have been constraints, it has also opened the world of opportunities. So where we could not go, like I've been wanting to go to Kashmir and cater to conflict places, or these kids have a lot of stress. So we did a stress management session for students of Kashmir. Then, like this, a lot of sessions happen across India. In fact, I could learn from clowns from across the world, and all of us could connect and know more about each other. And of course, about medical clowning, the awareness could be spread much more. So, despite the constraints, we have tried to work our ways. And once situation gets better, we are just waiting to go back to hospitals and meet our little friends.
Oh, okay. What message do you have for us this afternoon, Tushar?
Uh, Sorry, Nafeesa, can you please repeat the question?
Sure. What message would you like to leave us with this afternoon?
I think the message is that, uh, we could not have been in any worse situation than we are right now. I
That is
think
so true.
realizing that even in the worst of situation we are able to make our ends meet and still survive. That should be a hope for the, not just for the present happiness, but also for the future happiness. And I think the world can, uh, the world is, it's a very small place at the end of the day, because someone who we know sitting in another part of world can be actually struggling because of the issues that we are seeing these days. So why not, let's make the best out of what we can in the present.
Couldn't have said it better. And you have a lot to leave us with this afternoon.
I think the first message that I have is that whenever we visit people in the hospital, let's not visit them with a long face and talk about, oh, what went wrong. If we can go more cheerful and try to make them more cheerful, and if we can distract them from what they're going through, it's a great way to help patients and also their families. Secondly, of course, like Tushar said, this is like the worst phase. So, not forgetting to smile and be happy. Despite everything, we are alive and we are doing something. So, that's great. And also, I've learned that gratitude is really important. Just being grateful for what we have and appreciating each other. And also, if we like something in someone, complimenting them for that, not trying to just find criticisms or say negatives, because there is so much power in positive, and we
That's
all
so true.
need more positivity in our lives. And also giving ourselves a hug, since we can't hug each other, just hugging ourselves is so important, because that really helps in feeling better.
What message would you leave for those that are grieving at the moment? Of course, through COVID-19, loads of families have been affected by losing lots of loved ones, not just one, many. What message would you leave them with?
Firstly, I'm really sorry for what has happened, and uh, I don't know actually what message can I leave them with, because I'm not in their place. I can only say that time would heal, but we all know that we miss the person, the close ones. So I don't think I am the right person to answer this.
Yeah, no, I get what you're saying, because the thing is, you're there to give the hope, and I think maybe the message to leave them is just to keep the hope and the faith, and leave it in the hands of the Almighty to be able to give them that strength to be able to pull through the situation
Yes.
that they're in. And I think Tushar would agree with me on that as well. But I want to thank you so much, all the way from Delhi this afternoon. I feel so privileged that you've joined me on my show all the way in South Africa. So I want to thank Tushar and you, yourself, Sheetal, for joining us this afternoon and enticing us into a happier space. As you can see, I'm smiling, I'm happy, I'm laughing, and it means so much knowing that you've taken taken out that time to be able to actually educate us about Clownselors. Maybe we'll have to start incepting this in our South African hospitals once we over the COVID-19 period.
Yes.
Great. Thanks.
Thank you.
It's been a pleasure.
Thank you so much, and take care of yourselves. Do stay safe during this period, and we wish you nothing but the best going forward. Bye, Tushar.
Thank you so much.
Bye,
Thank you.
Nafeesa.
Thank you for having us.
The pleasure
Bye-bye.
was ours. Thank you so much. That was Sheetal and Tushar from Clownselors, giving us insight into, of course, going into places and spaces in Delhi and around India. Previously from before COVID, of course, and trying to entice people into a better space by making them smile, making them laugh, making them feel a little bit light-hearted. And I think that little goes such a long way. We're going to go for a quick break. Stay with us. We're going to be joining Sister Sam Keller after the break.